I'm your host, Neal Howard, here on Health Professional Radio. Glad that you could join us. In the last year alone, approximately 600,000 people were expected to die from cancer. A lot of those lives could have been saved through earlier detection. Now there's an awareness campaign that's taking aim at the statistic that says not many people are aware of early screening options. Here to talk with us about some common screening that everyone should know about is Dr. Robert Smith from the American Cancer Society and breast cancer survivor Debra Stansberry. Thank you both for joining us here on the program today.
Thank you.
Thank you.
Dr. Smith, it's very important to screen for cancer. Why is it so important to detect early through screening?
It's a great question, Neal. Cancer screening is for people without signs or symptoms of cancer. This means that when we screen for cancer, we're looking to detect cancer very early in its natural history before it is spread to other organs. And when we detect cancer when it's small and localized, then treatment can be much more successful, it can be much less aggressive, and the odds of surviving your cancer are really quite high. As you pointed out, there are many thousands of deaths last year from cancers that had we found them earlier, those deaths could have been avoided. So Cancer Screen Week is really targeting raising awareness about all the recommended cancer screening tests that should be a part of every adult's preventive health plan.
Debra, I do understand that you were diagnosed with breast cancer after your doctor recommended a mammogram. Were you asymptomatic?
Yeah, I had no symptoms. It didn't run in my family. I was fine, so I thought, but the mammogram actually detected a tumor, which ended up being stage 1 breast cancer. It was an aggressive form of breast cancer, but because we actually found it early, it was a successful treatment and everything that I'm actually here 9 years later. So, the mammogram was very, very important for me.
So it made a big difference, I guess, based on some of the things that you did not have to go through and some of the things that you're not having to go through now based on the early detection.
Right. Early detection is key to survival, and the fact that it was found at stage 1, we were able to treat it, and 9 years have passed, and I'm good, and been able to have regular screenings now because they're just kind of on top of checking me out, making sure that everything is good.
And Dr. Smith, in your experience, are there any types of cancers that lend themselves better to early detection than others? I mean, are there some cancers that almost no matter how early you detect them, there are going to have to be some very aggressive treatments for them?
Yeah, well, this is the case. It's a really good question. This is the case, I think, for all cancers. Most of the cancers that we find are going to do better when you find them early, no matter what. But some of those still will be more aggressive, and some are much, much more aggressive when they've been allowed to grow a bit larger. And that's why regular screening is so important, because when we don't get regular screening, if we do have cancer, then we're giving a tumor, and potentially a very aggressive tumor, an opportunity to grow and spread, and we've missed an opportunity to find it early when treatment would have been much more successful. There are many cancers that we don't screen for, but the ones that we do screen for account for a sizable fraction of all cancers diagnosed each year. And that includes not so much cervical cancer anymore, because we've very successfully reduced the incidence rate of that disease through regular screening. But breast cancer, colorectal cancer, prostate cancer, lung cancer, these are all cancers that account for a sizable fraction of the cancers that adults are diagnosed with each year. And we have screening tests that can both prevent some of these cancers, cervical and colorectal, and find all of them early and significantly improve the odds of survival.
Obviously, in the case of, say, colorectal cancer, a mammogram isn't the ticket. Is there some type of test that can detect cancer, say, in a blood test or something like that, and then you can go and say, well, maybe get a mammogram or a colonoscopy or something like that? Or are all of these different early detection options specific for their type of cancer?
Right now, we do principally screen for prostate cancer with a blood test. It's called
okay.
And basically measures inflammation, and it leads the healthcare team to do further tests to determine what's causing that elevated rise in PSA. Certainly, blood tests are in many ways the holy grail. We would love to have blood tests that can find cancer early. But keep in mind, if we do that, those tests have to be accurate. We have to be able to find the cancer after the blood test is positive. And this is a work in progress. We're not there yet, but I think everybody would look forward to the day that we can do that and successfully react to those results in ways that don't have a patient wondering for many years whether or not they have cancer and when it's going to show up.
Debra, were you ever inclined to get a second opinion, or were you so sure that your treatment was the way to go?
Well, I had, different. I had my gynecologist. I had, I was referred to an oncologist, and I had a surgeon. I had, so there were different, people who actually saw my case and was able to kind of help me decide, which route to go in treatment. So I didn't necessarily get a totally separate second opinion, but, I had different doctors at that time, that was able to kind of inform me, and they all saw the different, results.
Now, other than being involved, obviously heavily in Cancer Screen Week, what is your message for other folks who may be wondering about cancer or wondering about early detection for themselves or maybe a loved one?
Well, first of all, not to be afraid, or apprehensive about cancer screenings. Find out, what cancer screening is right for you, and having a conversation, setting an appointment with your own doctor to kind of go from there. We do have a website, cancerscreenweek.org, where you can actually go on, and, there's great information on there that tells you, what cancer screenings may be right for you.
And Dr. Smith, is there any place else that we can go online in addition to the website that she just mentioned that we can learn more about the organization?
Yes, the American Cancer Society's website is a great source for information about cancer, and in particular screening tests and the cancers that are their targets, and that is www.cancer.org. One other reminder to your listeners is your healthcare provider can be your partner in this effort to ensure that you get regular cancer screening. He or she can answer questions that you may have even after visiting these websites about these cancer screening tests, and also whether or not your individual risk might lead you to undergo one specific test or another or start screening earlier. So this is the other important message. And I would leave your listeners with one last thing. Oftentimes people don't imagine that if they don't have symptoms or if they don't have a family history, that cancer screening isn't important. Most people diagnosed with cancer don't have a family history. And cancer screening is for when you don't have signs and symptoms. If you have signs or symptoms, you need to see the doctor. When you don't, that's when we have an opportunity to find cancer, when it's very small and before it has spread.
Dr. Smith, Debra Stansberry, I thank you both for joining us here on Health Professional Radio. Some great information, and I'm hoping you'll return in the future and talk with us some more.
We look forward to that.
Thank you.
It's been a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. Be sure and visit our affiliates page when you visit our platform. Subscribe to the podcast on iTunes, listen in, and download at SoundCloud.